Welcome. I'm Lee Doherty Biddison.
And I'm Carolyn Kamsti-Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us.
Hello, and welcome back to our podcast. I'm Carolyn Kamsti-Fowler, and I'll be hosting today. And if you had an opportunity to listen to one of our earlier episodes, you heard Lee Biddison and I discuss the importance of fostering a culture of connection and support and how important that is for well-being. And that's why I am so excited today to introduce our two guests who are important and valuable colleagues to us and also friends to us in the Office of Wellbeing, Dr. Cheryl Connors and Dr. Matt Norvell. Matt is a board-certified chaplain. He's very well known in the world of pediatric chaplaincy especially, and he is the Spiritual Care and Chaplaincy Department Clinical Manager at the Johns Hopkins Hospital. But Matt is also the RISE, which is the Resilience in Stressful Events Program Team Manager at Johns Hopkins Hospital. Dr. Cheryl Connors, who is a nurse, works in the Armstrong Institute for Patient Safety at Johns Hopkins Medicine, but she is the RISE director for the Johns Hopkins Health System. Cheryl and Matt, together with Dr. Albert Wu, were the co-developers of the RISE program. And I hope that you will find the story that they tell of the development of it and also the importance of it really interesting and inspiring for you wherever you are today. Cheryl, can we start with you?
Yes, please.
Well, firstly, thank you so much for being here.
Thank you for having us.
Could you describe the RISE program, please, for our listeners?
Yeah, I would be honored to. So RISE stands for Resilience in Stressful Events, and it is a confidential peer support service that is available 24 hours a day, 7 days a week to anyone who serves Johns Hopkins Medicine. I say medicine because we have RISE teams expanded throughout our health system, but maybe I will mostly focus on the Johns Hopkins Hospital RISE program for the purposes of the podcast, since we have Matt here, who is our fearless leader at Johns Hopkins Hospital. RISE was created in 2010 when myself and Matt and colleagues, we had recognized that there was a need for something. And so we did some exploration to identify, what exactly was the need and how could we strive to meet the need. And what we found was that most of our colleagues were reporting that they were by definition at some point a second victim, meaning that they were traumatized by, either a medical error or adverse event as the caregiver in the position of the situation. And the second victim is actually a term that our friend and colleague, Dr. Albert Wu, coined back in the year 2000. So we had known quite a bit about it, and that's where we really targeted our exploration, and only to find out that, yes, people were in fact validating that this is a real thing, and most of our healthcare workers have experienced it. And then when we asked them about support that they received after experiencing this second victim phenomenon, they basically claimed that they didn't receive support, or if they were going to receive support, maybe they went to their supervisor. Now, I myself at the time was a supervisor, and I remember staff coming to me to talk about such things. And I also recognized that I really wasn't trained or equipped to manage that type of support. It was also on the long list of other responsibilities that a manager or supervisor would have if there was an adverse event or medical error. And then the other option for support, like the opposite end of the spectrum, was essentially to seek out counseling or therapy. And we fortunately do have access to an employee assistance program. And what we found is that staff were underutilizing it. They weren't utilizing it for these types of situations. So we further explored why. And what we heard from the healthcare workforce was that they didn't feel like they needed a counselor or a therapist, that at the end of the day, when they experienced something stressful, they really just needed to talk to somebody who could relate to that experience so they can, unload the heaviness that came along with it, and have somebody bear witness to their pain, to their distress, and then they could move on. They could, go home from work, come back to work, and not feel kind of plagued by this situation. So we then further asked our healthcare workforce, if we were going to create a support program, what features would this program have that would essentially fill this gap, fill this void, so that you could have support for those types of work-related experience or patient-related experiences. And they told us that they wanted something that was timely. So, if it happened today, that they might be able to pick up the phone and call somebody today, or if they weren't ready to process today, but maybe they were tomorrow, they can pick up the phone and not really need an appointment, not make it a formal process, that they wanted it to be timely. So when they were ready for it, that it would be available to them. They also clearly indicated that they wanted it to be a peer, somebody who works here at Johns Hopkins Hospital, somebody who understands the culture of the organization, understands the types of situations that we encounter, and more importantly, the impact that it has. Somebody who's trained, somebody who can effectively provide support. People would say that, yeah, I would go home and I sometimes would try to talk to my family about this, but I didn't really want to burden my family and make them worry about the things that I endure when I go to work. And they too didn't know how to offer support. So they were really interested in having somebody who knew how to provide support effectively. They also conveyed that it was important, since we're a 24/7 operation, that we have support 24 hours a day, 7 days a week. And then lastly, the other feature that we learned about was that they thought it was very important that this support be confidential.
Mm-hmm. Wow. Thank you, Cheryl. And to think that that has been going on 24/7, 365 for more than 13 years is truly extraordinary. So, Matt, can I maybe ask you to tell us a little bit about the value of RISE and the impact that you've seen RISE have over all these years?
Sure. It's great to be able to talk about this with you, Carolyn. When I think about both value and impact, I go in a few directions, and I think on maybe at least three different levels. I think about the value and the impact that there is for the individual employees who get support. I think about the value and the impact on the institution, and maybe even talk a little bit about culture there. And then I think about the value and the impact on the people that are on our team, the individual peer, we call them peer responders. When we think about the employees, it has been amazing to watch, right? So we started building in 2010, and then we went live in the fall of 2011. And to watch the way that our employee sort of workforce has embraced and come to appreciate and understand that when they need to talk about some sort of impactful or stressful work-related event, that they have access to that anytime. And I was actually a few minutes ago, just before we were meeting today, I was at an orientation to be able to talk to some new employees about the availability of this program to them. So they're brand new coming into the institution. And when we talk about, we want to provide this service because we're interested in them being whole, healthy people who also are good employees who work here, you can watch their faces change a little bit. People appreciate knowing that somebody is available to pay attention to them as a human and to listen to their particular concerns as it relates to whatever work-related thing that they encountered. And so it's been really fun journey to watch this unfold and become more and more engaged. You know, when we first started out, we got about one call a month. And we were super happy that one call came in every month. We got about one, you know, and we have an internal kind of messaging system is the way that people reach out to us. And so with that, you know, people would reach out, and when we would have one of our peer responders go and provide that support to them. And it was so satisfying to know that at a minimum, we gave that one person a safe space to talk about something that was really on their hearts that they had experienced. Today, you know, the pandemic was a big blip as we look at usage. We went from in January of 2020, I believe we were at about 12 to 15 calls a month. And then in the spring of 2020, we did about 7,000 employee encounters between March and June of that year. So that was a blip. Today, we've leveled back out, and our usage has definitely increased. We're at about 30 of these different encounters a month now, being able to provide this support to people. So when I think about that, it helps me transition of thinking about the value or the impact for employees to be able to think about the value or the impact for institutions. As Cheryl mentioned, when she was a nurse manager, most of our nurse managers are really good at managing their units. They're really good at sort of the business side of making sure there's enough people in the right places to be able to do their work. They're really good bedside nurses. And it varies on their own individual experience level about how good they are of providing that interpersonal support whenever somebody has had an impactful thing. And they're in a tight spot. It's not just nurse managers, it's any leader, because they want to provide support to the employee that's in front of them because they know that's necessary and important. And they're trying to run whatever is their responsibility. And so it's a tough balance to take that time and to be that sort of safe listening ear while they're also watching safety issues and they're also watching staffing issues. So that really starts to speak to the impact on the institution. The existence of our program has offloaded a little bit of that emotional support responsibility, that real-time emotional support responsibility, offloaded it off of those manager level folks and off of our hospital leadership folks, because they know and they trust us that we're going to help take care of the people when they need it. And so they can pay attention to the rest of their jobs there, and they know that we're going to be a part of it. And so that's been a really satisfying thing to watch about how it's impacted the institution is made up by a bunch of people. As we look at the different people with the different very serious jobs that they've got at every level, that sort of corporately has come together to make a big difference, I think. And then when I think about the impact on specifically on the people on our team, the people that volunteer their effort, our peer responders on our RISE team, we hear again and again how much they appreciate the opportunity to help in this way. All of the people on our team have other very real, very serious jobs. And they still volunteer a couple times a month to be able to be the person that will show up and give an individual or a team space to talk. Not too long ago, we got a call from a nursing unit that had 3 deaths in like a 36-hour run. And they don't normally have 3 deaths in a 36-hour run. And they just wanted somebody to come and sit with their team and give them a chance to talk about it. Not an event debrief, but a chance to be able to talk about it. And so our people find a lot of satisfaction in the opportunity to be able to provide support in that way. And so I think that it impacts the sort of life and job satisfaction of the individual peer responders on our team also.
Thank you, Matt. I was going to mention this later, but I should disclose right now that I am a RISE responder, so have been trained by you, and I would absolutely agree. It's one of the most rewarding things that we get to do for each other.
It's always great to be interviewed by an insider. Thank you, Carolyn.
The insider track friends. Cheryl, as you think about getting the RISE program started and sustaining it over all these years, what do you think has been essential to its success?
Yeah, I'm going to emphasize some of the things that Matt had already said, and maybe that I already said too when I talked about what RISE is. But there's two ingredients I think that really are essential to the success of a program like RISE. And the first is leadership support. And I'll start from the very beginning. So this program, like any other program or project that somebody tries to get off the ground in a healthcare environment, you would anticipate there to be some challenges, some barriers, and that it might actually be quite difficult. And I would say that none of that was true really for us when we were implementing RISE, because we had leadership support from the very top. Our president, our VPMA, our director for safety and quality, they were all very much executive champions from the beginning. They sat at the table as we were talking about some of the special features of a program like RISE, and I'll start referring to it right now as a culture-changing program. And the features that we were talking about that really needed leadership support behind the program was features like the confidentiality aspect. We had to work very closely with our chief legal counsel to make sure that we understood those, boundaries around confidentiality and how peer support was unique compared to anything else that we're doing as we were serving as peer-to-peer. It wasn't a provider to patient type of relationship that really helped kind of support the confidential aspect of the program. Leaders also needed to stand behind us and be the champion. So they were helping us to campaign for the program, advocating for the program. They had a voice in helping us to design the program. And then I think what was important from the beginning and continues to be incredibly important is that our leaders are the people who endorse the volunteers who say, I want to be a peer responder. And so Carolyn, I'll use you as an example. If you're going to apply to sign up to be on the RISE team, that we would need you to have your director sign off on that. And we ask that of every person that volunteers. So it's really important for our leaders to understand what we're asking of these volunteers, and that we look to them to make sure that we are onboarding people who are qualified to do this. Maybe they have innate skills, and maybe they're also willing to learn more about how to do this well. And it's both. You can come to this with some natural skill, but we also do training that helps people understand what those principles are to provide effective peer support. And then I think another part of leadership that we learned so much about was in 2017, around then, we realized that our utilization, our activations were mainly coming from our leaders, our managers. And we wanted to understand that a little bit better. And this is where I'm going to emphasize some of what Matt said. Our leaders saw RISE as an incredible resource that helped them offload some of their already very demanding role. And they found it as a way to be more of a support to their staff. And the other thing about that is by the leaders activating the program, they're acting as models, and they're saying, this is really important. It's important enough for us to take the time to receive support. And so they are very much instrumental in that culture change that I had mentioned.
Mm-hmm.
The second part of this is that we have skilled peer responders. That's the other essential ingredient. And I say that because they are the life of the program, actually. These are people who are, as Matt said, they're willing to do this work. They're actually very excited to do this work. We had a chance to interview some of them, and at the end of the week, they'll say the thing that was most meaningful for me this week was the RISE encounter that I had, the support that I was able to provide. And these are people who are willing to go through training, and they're willing to become a part of another team and they are multidisciplinary. So it's really nice to build these connections across the organization. But yeah, I can't say enough that they are the life of the program.
Thank you, Cheryl. So maybe, Matt, could I just toss it back to you to just give us a brief overview of the peer responder recruitment and training?
Sure thing. When we first started, we were starting from zero. And so we went to, and a lot of institutions, when they're doing this today, they go to their leaders around the hospital and say, hey, who on your unit and your department do people already talk to? We started with, I think our original number, there was 18 of us on the team. And we quickly learned that was not enough people to be able to provide 24/7 support like this on a volunteer basis. And so we recruited some more folks. And then today, all this time later, the way that we do our recruitment is it's pretty passive. Like, people find out about us and they find about the mission of the work that we do in our program, and they reach out to us and they say, hey, I think I might want to be a part of that. I've also onboarded some people under our team recently who their managers identified in them that they have a natural skill set that might be valuable and might fit with their with our team methodology and planning. The other thing that I've recently been able to catch on to is managers have recognized, hey, well, wait a second, it would be valuable to have people in my unit that already belong to our area trained in this approach. And so they're willing to let them have a little bit of flexibility to do the RISE encounters because they know that there's an internal benefit to their unit. So that's a little bit of the recruitment. We do the peer responder training now it's about 6 or 7 hours, depending on how much the group talks. But it's about 6 or 7 hours, and it's a full day. And Cheryl and I usually do that together. And we do that now at our hospital. We do that 3 times a year. And anybody that wants to is able, anybody in our system that wants to is able to take the training. And sometimes they take it just because they are looking for some personal enrichment on their own sort of listening and communication skills, because that's really the focus of the day, is helping people pay attention to the baseline challenges that are in a healthcare system and sort of the emotional impact of it. And then what are the ways that we can be a non-judgmental, listening, compassionate support to our colleagues? And so some people take that just for themselves, to be a better person. And then some people take it knowing that they want to be a part of our team. And so we have our own onboarding process like everybody else does, but they take the training and then we do an interview and then we sort of do some onboarding training for them to make sure that they're ready to be able to provide the support that they need to. It can be intimidating for people the first time, because sometimes when we get a request for support, it's just a phone number. Like, somebody has reached out to us through our messaging system. They just gave us a phone number. And for some that have never called somebody that they didn't know who might be in distress, that can be an intimidating sort of first hump of the roller coaster to go over. But most folks find that once you can make that connection and the person knows that you're there to provide support, it really, the natural caring skills take over, and people find that it's really easy and satisfying for them to be able to do.
Thanks. And I really appreciated that you offered opportunities for us to shadow experienced peer responders before we had to go solo or leader response.
Yeah, as the leader of our team, I find that it's my job to make it as easy as possible for our peer responders to be able to provide that support and get sort of the positive endorphin hit of helping somebody. And so I try to control the organization portion of it as much as I can so that it's easy for them to be able to do that. And similarly, people, when they apply to be on the team, they say, oh, how long is the onboarding process, or how many people should I shadow? Because that's so much of the medical approach is, see one, do one, teach one, or, you need to shadow X number of hours before you can go do one of these things. And I tell people, I want you to shadow until you are comfortable and confident to be able to go do this on your own. And some people, maybe they come from a background where they've done this kind of helping before, and they jump in pretty quick. And some people
Mhm.
takes a little bit of time to be able to feel confident to do it, but everybody gets there eventually.
Well, so perhaps can I ask you just to once again, maybe briefly, talk about the importance of how you care for the resiliency and the well-being of the peer responders themselves.
Well, the two things that I kind of think about from my perspective that I do on that is, as I just mentioned, I try to make it as easy as possible for them to do it. I don't want this to be too much of an extra burden on their time. And we ask them to be on call a couple times a month, which can be a burden for people. And so we really try to work to make that the process, the logistics of it as easy as possible. So I care for them in that way. Another important way that we do it is we really I'm regularly checking in with people, especially after they've had an encounter. We debrief every one of those encounters to be able to make sure that that person is cared for, because maybe they heard a story that is way outside their experience, their normal experience, and they need somebody to process that experience with. And so we want to make sure that they're cared for and they're not left out there. In fact, I just had this the other night. A call came through and it was sort of later in the day, and I just reached out by text to our peer responder who was taking that call and said, "Hey, if you want to talk afterwards, I'm available." And she called me back at 10 o'clock at night and said, "I really need to process this because that was a really wild thing I just heard," right? And because it's in a hospital, you hear stories that we don't normally experience. And so just being able to give that person a chance to process that and not be stuck with the emotion for themselves. And then the last thing that I'll mention about how I really focus on caring for our peer responders is I try through weekly emails, through different conversations to help them understand the importance of the work that they're doing and the take-home value that they're doing. And when we get positive feedback from somebody of, "Oh, it was so great that your team came and did this," I try to pass that on to the individuals that were involved, because I want them to know it's not just your effort and your personal thing that you're getting out of this. It is rippling out and helping other people. And I think all of us get a really positive, it's a positive feedback loop to know that what we have done helps. And when we can do that, when we can make sure that people see that, I think it feeds everybody. It helps everybody float a little bit higher.
Yeah, this is such a powerful example of what happens when people know that they're working in an environment where somebody is going to be there for them, that they feel that they're connected, meaningfully connected and supported. So I want to thank both of you for your leadership of this. It's been a fascinating journey, and you've expanded it well beyond our health system across the country. So thank you to both of you. Cheryl, I'm going to turn to you for the last question. And that is, if any of our listeners today were interested in learning more either about RISE as it is now, or perhaps even how to start a peer responder program in their own organization, where can they find more information?
Yeah, thanks, Carolyn. We're very excited to share with the world how to get more information on RISE. And maybe I'll start with our internal folks. So if you are a part of Johns Hopkins Medicine, we want you to know that we have an intranet site that's easily accessible, where you can find out all of the information, how to use the program, how to become a part of the program, why you might use the program. And that could be found on my.jh.edu, and we have a RISE title. So all you have to do is type in RISE under apps, and it should easily pop up for you. And you can get all the information that you need if you're a part of Johns Hopkins Medicine. For the external folks who are not a part of Johns Hopkins Medicine, I am happy to share that the Maryland Patient Safety Center, they found out about us around 2015 and asked us to be their partners. And they felt very passionate that this was a good model for peer support, and they wanted to help promote peer support programs in other organizations external of Johns Hopkins. So they sponsored us to create this curriculum that we could use to help other organizations get a program off the ground. The program through the Maryland Patient Safety Center is known as the Caring for the Caregivers Implementing RISE program. And if anyone just goes to a internet site and you type in the Armstrong Institute, and then you look for Caring for the Caregiver Implementing RISE, it'll bring you to the page that also has the link on there for the Maryland Patient Safety Center. So you get connected with our business partner. We also have some resources on there. So if an organization thought they might want to try to implement a program without our support, there's some tools on there that they can absolutely use to guide them through some of the steps that are really essential in setting you up for success.
Thank you so much for that, Cheryl. And for everybody listening, we will link to those sites that Cheryl mentioned on the episode page for this podcast. Friends, thank you so much for being here. Thank you for everything that you do. We are so delighted to partner with you in the Office of Wellbeing. And I hope that what you've shared today will be really meaningful and potentially impactful in future for those people listening to our podcast. Thanks, everyone. And thank you for listening.
And thanks for all you do, Carolyn.
So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.